Definition: heart functions can be assessed to large degree by finding and the history by symptoms by clients, general appearance, and by rhythm and quality. Direct examination of the heart, and however, offer the specific information and including heart size, such as findings as lift. So purpose to determine any presence of pulsation, even that may be indication of underlying condition, to determine any presence of asymmetric pulse columns, birth, as well as visible distant veins. So the equipment are stethoscope, centimeter ruler. So the consideration before, during, and after the procedure is to observe appropriate inspections and control procedure and put the patient in the semi-recline position. Inquires the client has any regarding heart diseases. So the things to document after the procedure is to document finding in the client and record formal checking.
Central vessel. To palpate the carotid artery, lightly place your finger just medial to the trachea and below the ankle of the jaw. The pulse should be regular and equal to the strength in both arteries and palpated vibration of the arterioles and press. Auscultate for vascular sound over the carotid arteries. This is to determine for the presence of build. Inspect the internal external irregular vein and determine for the type of the palpations of procedure. These to provide information about blood volume and presence in the high side of the heart. Inspect the palpate and aortic and pulmonary areas. Note for the palpations. This to note for the absence of presence of palpations. Inspect and palpate the gastric area at the base of sternum of the abdominal aortic palpations. This to identify if there is the abnormal aorta prevent nursing intervention. Place the client in semi-flower position and auscultate the aortic, pulmonic, tricuspid, and apical area. Use both bell and diaphragm of the stethoscope. This to identify the adventurous of heart sounds. Peripheral system. Inspect the peripheral veins in the arms and legs. Note for color, temperature, and any presence of edema. This to determine the position and presence of destination of the medullary bulgar and colds. Palpate the peripheral pulses: temporal, radial, branchial, inguinal, femoral, and polyptial, dorsal pedis, and posterior tibial. Palpate the pulses on both sides of the body and symmetrically. This to identify for presence of abnormal palpation. palpate the auscultate for the apical pulse. This to determine the presence of abnormal pulsation. Assess the pulse of the rate, rhythm, equality, amplitude, and elasticity. Describe the pulse and amplitude on a scale of 0 to 4. 0 to absence of the palpate, demonstrates very palpable, 2 normal, 3 full decrease, 4 bonding. This to determine the pulse, rate, rhythm, equality, and amplitude, and elasticity. Assess the peripheral length for any signs of edema and versus the sites and phlebitis and grade for the pitting edema and 1 plus and 2, 3 and 3 to 5 plus and according to its depth. To look